What if a medicine that's supposed to help is quietly doing harm instead? Today, I want to walk you through 5 prescription drugs I personally would never let someone I love take lightly because the risks are deeper than we often hear about. Many of these medications look harmless. They are prescribed all the time. They seem like a quick fix, but some carry serious hidden dangers, and those dangers can quietly spiral into something much worse. By the end of this video, you will understand why certain painkillers can be a silent threat, how some anxiety and sleep medications quietly erode memory or lead to dependence, why a drug meant to soothe nerve pain can actually increase the risk of falls or overdose, how aggressive antibiotics can damage tendons, and when cholesterol-lowering pills might trigger muscle breakdown. Most importantly, you'll see why these are not just medicines. They are powerful substances that demand respect, serious caution, and close monitoring. If you care about someone, your parent, sibling, partner, this video could help you protect them. That is why it matters. Welcome to our channel. If you want to stay informed about the safe use of prescription drugs, hit that subscribe button now. Let us dive in. Every medicine, no matter how common or well-known, comes with a set of side effects. That is a fact that doctors and pharmacists always remind us of, and it is completely normal. Some people might experience mild discomfort. Others might barely notice anything at all, but the potential for unintended consequences is always there. This is why understanding the risks behind any medication is not just important, it is essential. While most medications are designed to improve health and treat specific conditions, some carry hidden dangers that are not always obvious at first glance. These dangers become more pronounced when a drug is misused, prescribed without careful oversight, or taken over a long period. What seems like a safe routine prescription can, in certain circumstances, lead to serious health problems, sometimes even life-threatening ones. The medications we will discuss are not banned or illegal. They are approved and commonly used. That is exactly why the conversation is so important. Because these drugs are prescribed frequently, many people assume they are entirely safe, and that assumption can be dangerous. The risks may include long-term organ damage, dependency, cognitive decline, or increased vulnerability to accidents and other health complications. These are real-world consequences that have been observed repeatedly in clinical practice and medical research. The goal here is not to create fear, but to highlight the importance of awareness. Understanding the full picture of a drug's effects allows individuals and families to make informed decisions and take precautionary measures. By looking closely at these medicines, you will see patterns of risk that are often overlooked or underestimated. This is a conversation rooted in evidence, not opinion. The examples we will go through are based on documented side effects, reports from patients, and studies conducted over years of medical observation. Recognizing these patterns is crucial for anyone who takes medication themselves or cares for someone who does. It is about knowledge, preparation, and approaching prescriptions with careful attention rather than blind trust. Prescription opioids are among the most powerful painkillers available today. Medications like morphine, oxycodone, and codeine are often prescribed to manage severe pain, whether after surgery, injury, or for chronic conditions. They work by binding to specific receptors in the brain and spinal cord, effectively blocking pain signals and creating a sense of relief. On the surface, these drugs appear to be a blessing for those struggling with intense pain. They can offer rapid and effective relief, allowing people to function when pain might otherwise be debilitating. However, the very strength that makes them effective also makes them incredibly risky. One of the most serious dangers associated with opioids is their effect on breathing. At higher doses or when misused, opioids can slow breathing to dangerous levels, sometimes causing fatal overdoses. This risk is not limited to people taking more than prescribed. Even normal doses can become dangerous in combination with other medications or in people with certain health conditions. The potential for overdose is a constant silent threat, and it is one reason these drugs require such careful monitoring. Addiction and dependence are another major concern. Prescription opioids can create a powerful physical and psychological reliance. The body can quickly adapt to their presence, leading to tolerance where higher doses are needed to achieve the same effect. This process can escalate quietly, often before anyone realizes how serious the problem has become. Withdrawal symptoms can be severe and frightening, making it extremely difficult for someone to stop once dependence has developed. Long-term use of opioids carries additional hidden consequences. Chronic use has been linked to fractures, likely due to bone density changes and increased risk of falls. There are also documented effects on mood and overall well-being, including depression and a reduction in libido. These are not side effects that are immediately obvious, but over time, they can significantly impact quality of life. In the real world, prescription opioids are tied to a growing number of overdose-related deaths, highlighting that these drugs, while medically valuable, carry real and substantial risks. Even under careful supervision, the margin for error is small, and the consequences can be severe. Benzodiazepines are a class of medications commonly prescribed for anxiety, insomnia, and other conditions affecting the nervous system. Drugs like diazepam, clonazepam, and lorazepam are well-known examples. They work by calming overactive areas of the brain, helping to reduce anxiety, relax muscles, and induce sleep. For many people, the effects can feel immediate and reassuring. They can quiet racing thoughts, ease tension, and provide a sense of control during stressful times. Because of these effects, benzodiazepines are often seen as a quick solution for emotional distress or sleepless nights. However, the relief they provide comes with significant hidden dangers that are easy to overlook. One of the primary risks of benzodiazepines is dependence. The body and brain can quickly adapt to the presence of these drugs, leading to tolerance and the need for increasing doses to achieve the same calming effect. Over time, this can develop into addiction, making it extremely difficult to stop without experiencing intense withdrawal symptoms. Withdrawal can involve anxiety, insomnia, tremors, and in severe cases, seizures or life-threatening complications. Stopping abruptly after prolonged use can be dangerous, which is why careful medical supervision is required if discontinuation becomes necessary. Long-term use of benzodiazepines is also associated with cognitive decline and memory impairment. Studies have shown that extended use can affect attention, learning, and overall brain function. These effects can accumulate slowly, making it difficult for users and their families to notice until significant changes have occurred. Older adults are particularly vulnerable. The combination of sedation, impaired coordination, and slowed reaction times increases the risk of falls, fractures, and accidents. Even seemingly minor doses can contribute to serious injuries when balance or alertness is compromised. Beyond physical risks, benzodiazepines can alter mood and emotional resilience. Dependence on the medication can mask underlying issues without resolving them, leaving individuals reliant on the drug rather than addressing root causes. The combination of addiction potential, cognitive effects, accident risks, and difficult withdrawal makes benzodiazepines a class of medication that should never be taken lightly, even under medical supervision. Gabapentinoids, which include medications such as gabapentin and pregabalin, were originally developed to treat nerve pain and epilepsy. Over time, their use has expanded to include management of anxiety and other neurological conditions. On the surface, these drugs often appear safer than traditional painkillers or stronger prescription opioids. They are widely prescribed, and many patients assume that because they are not classified in the same high-risk category as opioids, they are largely harmless. However, recent evidence has shown that gabapentinoids carry significant risks, particularly when used over long periods or in high doses. One of the most concerning issues with gabapentinoids is their growing potential for misuse and abuse. Reports have increasingly highlighted that these medications can be taken in ways that produce euphoric effects, leading some individuals to use them outside of prescribed guidelines. Even when used as directed, the risk of dependency exists. An abrupt cessation after long-term use can lead to withdrawal symptoms that are uncomfortable and, in some cases, dangerous. Another critical risk arises when gabapentinoids are combined with opioids or other depressant drugs. The sedative effects of these combinations can significantly increase the likelihood of respiratory depression, overdose, and death. Cases have been documented where individuals taking both medications have suffered fatal consequences, underscoring the dangerous interaction between these drug classes. High-dose use, which is becoming more common in clinical practice, magnifies these risks further. The perception of gabapentinoids as safer alternatives can be misleading, and reliance on them without careful monitoring can lead to serious harm. Deaths associated with gabapentinoids are often linked to polypharmacy, where these medications are taken alongside alcohol, opioids, or other depressants. Even though gabapentinoids provide genuine therapeutic benefits for many patients, their safety profile is not as simple as it might seem. The combination of misuse potential, increasing high-dose use, and dangerous interactions with other substances makes them medications that require extreme caution. Awareness of these risks is essential, especially for anyone considering their use for chronic pain, nerve conditions, or anxiety. Fluoroquinolone antibiotics, including well-known drugs such as levofloxacin, are powerful medications used to treat a wide range of bacterial infections. They are often prescribed for urinary tract infections, respiratory infections, and certain gastrointestinal conditions. Because they are highly effective at targeting bacteria, they are sometimes considered a convenient choice for treating stubborn infections. However, beneath their effectiveness lies a profile of risks that are often underestimated or overlooked. One of the most serious concerns with fluoroquinolones is their effect on tendons. These antibiotics have been shown to increase the risk of tendinitis and, in severe cases, tendon rupture. The Achilles tendon is particularly vulnerable, and injuries can occur even in individuals who are otherwise healthy. The onset of tendon damage may appear suddenly, sometimes during or even weeks after completing a course of the medication. This is especially concerning for older adults or those who are physically active, as tendon injuries can be long-lasting and may require surgical intervention or extended rehabilitation. Fluoroquinolones can also affect muscles, joints, and the nervous system. Patients have reported muscle weakness, joint pain, and nerve-related issues, such as tingling, numbness, or burning sensations. These neurological side effects can extend beyond the peripheral nerves, sometimes affecting balance, coordination, and overall mobility. In some cases, these effects are persistent, lasting months or even longer, which can severely impact daily functioning and quality of life. The potential for central nervous system effects is another layer of risk. Anxiety, confusion, insomnia, and even seizures have been reported, highlighting that these drugs can reach beyond their intended bacterial targets. Because of these wide-ranging impacts, fluoroquinolones are not considered a first-line antibiotic unless absolutely necessary. Safer alternatives often exist for many infections, and careful consideration should be given before prescribing these medications, particularly for loved ones who may be more vulnerable to side effects. The combination of tendon, muscular, nerve, and neurological risks makes fluoroquinolones a category of medicine that demands caution, careful monitoring, and judicious use. Statins are among the most widely prescribed medications in the world, primarily used to lower cholesterol levels and reduce the risk of heart disease. Drugs such as simvastatin, atorvastatin, and rosuvastatin are designed to help prevent the buildup of plaque in arteries, which can lead to heart attacks and strokes. For many patients with high cholesterol or cardiovascular risk factors, statins have proven life-saving. However, like all medications, they are not without significant risks, particularly when used improperly at high doses or for extended periods. One of the most commonly reported side effects of statins is muscle pain, also known as myopathy. Patients may experience soreness, weakness, or stiffness that can interfere with daily activities. In rare but severe cases, statins can trigger rhabdomyolysis, a condition in which muscle tissue breaks down rapidly, releasing substances into the bloodstream that can damage the kidneys and become life-threatening. While these extreme reactions are uncommon, they highlight the need for careful monitoring, especially when higher doses are prescribed. Long-term use of statins has also been associated with potential liver damage. Regular liver function tests are often recommended for patients on prolonged therapy because elevated liver enzymes can indicate stress or injury to the liver. Although serious liver complications are rare, they can develop silently over time, making awareness and monitoring essential. Another area of concern is cognitive function. Some individuals taking statins report memory loss, confusion, or difficulty concentrating. While research is ongoing, these effects have been observed in certain cases, particularly among older adults or those on higher doses. These cognitive issues, though often reversible upon discontinuation, can significantly impact quality of life while the medication is being taken. While statins are undeniably valuable for managing cardiovascular risk, using them without clear medical guidance, especially as a preventative measure in otherwise healthy individuals, can backfire. The combination of muscle, liver, and cognitive risks underscores the importance of personalized medical supervision. Proper evaluation, dosage adjustments, and ongoing monitoring are essential for anyone taking these drugs to ensure that the potential benefits truly outweigh the possible harms. It is important to stress that this list of medications is not meant to discourage the use of medicine in general. Many of the drugs we have discussed are life-saving when used appropriately, and for countless patients, they provide essential relief, prevent serious complications, and improve quality of life. The goal is not to create fear, but to promote awareness and caution. Understanding the risks associated with any medication allows individuals and families to make informed decisions rather than relying solely on assumptions or common perceptions. Every drug carries benefits and potential harms, and balancing those factors is a crucial part of responsible healthcare. One of the most important considerations when taking any medication is consulting a qualified healthcare professional. Stopping, refusing, or altering a prescribed drug without guidance can lead to serious health consequences. Healthcare providers are trained to weigh the risks and benefits based on each person's medical history, current conditions, and other medications they may be taking. Open communication with doctors, pharmacists, and other medical professionals is essential to ensure that medications are being used safely and effectively. Another area that requires careful attention is polypharmacy, the practice of taking multiple medications at the same time. While sometimes necessary, combining different drugs can amplify risks due to interactions, side effects, or overlapping toxicities. Even medications that are considered relatively safe on their own can become dangerous when mixed with others. Being aware of all prescriptions, over-the-counter medications, and supplements a person is taking helps reduce the risk of accidental harm. Safe drug practices are key to minimizing these risks. Following prescriptions exactly as directed, monitoring for any side effects, and promptly reporting unusual symptoms are all critical steps. Properly storing medications and disposing of unused or expired drugs prevents accidental ingestion or misuse. Being proactive and informed about the medicines taken at home can make a significant difference in health outcomes, ensuring that medications provide their intended benefits while minimizing potential harm. These five medicines are ones I would personally be very cautious about if someone I care about needed them. Each of them carries risks that are easy to overlook, and even medications meant to help can sometimes do more harm than good if not used carefully. If you or someone you know is taking any of these drugs, take the time to talk to a doctor, ask detailed questions about potential risks, and stay informed about safe usage. Knowledge and vigilance are the best tools for protecting your health and the health of your loved ones. Which of these medicines concerns you the most? Let me know in the comments below. I would love to hear your thoughts and experiences. To make sure you never miss content like this, hit the like button if you found this video helpful, and subscribe to our channel for more insights on medication safety, health tips, and ways to stay informed about your well-being. If you want, we can also create videos showing how to safely discuss medications with your doctor and recognize signs of misuse, so stay tuned for more practical advice.